Hello and welcome to the session today for the support group. And the topic of today's discussion is coping strategies for managing stress during the COVID-19 shelter-in-place orders. Exercise, sleep, eating healthy, and stress-relieving activities do indeed help. My name is Mary Hudson-McKinney, and I am a professor at Azusa Pacific University. I've been a physical therapist for the past 37 years and a neurologic clinical specialist. And I have known Martha Murphy for quite a few years as well. So I'm trying to think how many, but quite a few. All right, so what are we going to be covering today? So why is exercise important during the COVID-19 pandemic? And that's for individuals with dystonia, as well as all of us. And then how can I stay healthy and active despite the COVID-19 closures? I want to think about creating healthy habits for myself. And then as I'm exercising, especially in individuals with dystonia, how might I prepare my brain to help me to go ahead and exercise as optimally as possible? And then what are some strategies I want to consider when training the brain? And then you will also want to remember this is a very challenging time, just an immensely challenging time. And so you want to remember the importance of your physical health, but also your mental and your emotional health as well. And so we're going to be going over some strategies, looking at a concept called mindfulness. We'll be doing and looking at some mindfulness practice strategies and helping you guide towards maybe an optimal treatment strategy that's going to be best for you. And so we're going to be talking about the use of traditional exercises, looking at flexibility, looking at improving and basically factoring in strength imbalances that exists in your body as an individual with dystonia, looking at the importance of balance, the importance of posture, and looking at some things that you can be doing that will actively help you out. We'll be looking at standard, more typical physical therapy exercises that you can try. We're going to also sample or talk about the use or sampling of Tai Chi exercises, seated Tai Chi, and then seated yoga exercises. And so I think that's going to be a lot of fun as well. And then we're going to end with going over some important COVID-19 tips. So before I begin, I want to let you know that that as you sample through and look at some of these exercise options, you can think about if you have exercised or utilized a physical therapist in the past that you've enjoyed working with, you could take this exercise program to that individual and have that individual review which components would be optimal or best for you. And just remember that there are many outpatient physical therapy clinics that are actually open during the COVID-19 pandemic to help to treat and help their patient populations. And then if you don't feel comfortable going into the clinic, many physical therapists are using telehealth. So it's not just physicians that are doing it, it's physical therapists as well. And then in regards to the issue of mental health concerns, maybe going through a bit of depression or a bit of anxiety, remember that there are psychologists that you could reach out to during this period of time. And so again, many psychologists are seeing patients in their clinics, or they're seeing patients actually telehealth as well. And Martha Murphy, the support group leader, or your wonderful support group leader, will provide you with some amazing individuals. If you don't know those individuals, she can help you with arming you with specific names, or you could go back to your doctor and have a chat with your doctor as well. All right, so let's go ahead and step on into the lecture. So why is exercise important during this pandemic? So Regular exercise is actually essential for everyone, even under normal circumstances, but it becomes of paramount importance during the COVID-19 pandemic. And there's several different factors. So we know through research that exercise can help boost our immune system. So research has shown that moderate amounts of exercise at moderate intensity can actually enhance our immune system, and that's going to be super important during this period of time. Exercise may help us with weight gain, and so it helps us burn extra calories. And so we want to be looking at both sides of the equation. We want to look at exercise as the way of controlling the input that you put in, and then also controlling that consumption side of the equation. So how much food perhaps that you're consuming as well. And then exercise also helps in reducing stress and anxiety. So we know that exercise is a mood booster in a variety of patient populations and in adult populations as well. And so it helps us to build, or it might be a tool or a brick in terms of building emotional resilience. And since we are sheltering in place, we may be actually sheltering in place with our families. And so exercise programs are a great way of developing yet another activity that the family can do that will be helpful for everyone in the family, including your furry family. Your dogs, for example, might enjoy a nice little walk. And then if your family is not directly present, what a lot of families are doing is they're actually setting up Zoom exercise sessions. And so it's a way of allowing us to really get that link, that human link, that human ability to reach out and communicate with one another that we all very much need. And then finally, exercise actually improves our sleep. So it helps us to get to sleep faster, and then it helps us to drop into a deeper sleep, the REM sleep. And so it's a better quality of sleep as well. So there's just a host of reasons why exercise is critically important. And then how can I stay active during this period of time, during closures? So with individuals with dystonia, you have a unique component. You want to really think about working slowly, listening to your body, setting goals and believing in yourself. You might want to try one exercise at a time versus trying all the exercises all at once. And then remember that you can reach back to the physical therapist that you worked with previously, and they can be an asset to you. If you don't have a physical therapist that you've used in the past, I've given Martha permission that you could reach out to me if you had some additional questions as well. We want to make sure that you guys are well tended to. You want to remember that breathing is an important component of exercise. You're going to be seeing it during the more traditional physical therapy exercises, flexibility exercises that we do today. And then when you tap into the links for the seated yoga or the seated Tai Chi, you'll see that the instructors talk about the importance of breathing through the exercise program as an important piece as well. Think about taking baby steps. So do it step by step is an important process. So try one exercise in one day, or as you're performing the exercises, think about your body posture and your alignment. Think about how far you can go. That's maybe a pain-free arc of movement. And so you might not be able to do 100% of the range, but try building up that portion of that range as you continue to go. Remember to take frequent rest breaks. So if you're not used to exercise, you might need to build yourself up slowly and over a period of time. And the other important thing to really do is recognize your successes. So pat yourself on the back in terms of developing an exercise plan for yourself, committing yourself to performing that exercise plan, and then doing that. So remember to pat yourself on the back, or have your families or each other be supportive to one another. And then the other thing that's really, really helpful is to establish a practice routine. So if you can set up a time of day that you're used to doing the exercises, that sometimes can be helpful. And so if you establish a routine, then that's quite helpful. And just stop and rest as much as you need. And so as I'm going through these exercises, there are several different ways that you can sample this session today. So you can, if you're used to exercising, follow me through the entire exercise program, or you could try one or two of the exercises and then watch the remaining exercises that I demonstrate, or you can choose to just watch the whole session this first time, and then on another go around choose to go ahead and complete the exercises at another period of time. And so just take it at your own pace. That is perfectly fine to think about doing that. So now let's think about the concept of preparing the brain. So there's a concept in the literature called mental imagery. And so this is a tool that athletes have been using for many years, where they think about an optimal movement sequence in their mind's eye. So without performing the movement, they're thinking about performing the movement. And what we know from fMRI imaging is that the images show that the areas of the brain that are responsible for completing that movement actually light up, even when you are going through this mental practice period. And so it's a rich and potent technique that skilled athletes have used for many, many years. And we're now tapping into this strategy in our patient population. So this is something that you might want to think about doing. So before performing the exercises, think about what are the steps and the sequences that you would like to go ahead and be able to do, and go over those like running a video in your mind. And that will help to kind of prime the area of the brain that you're going to be using then when you actually do perform those exercises. So your mind is actually a really powerful tool. Okay, so then training the brain. So you want to go ahead and think about going slowly and at your own pace. You want to, again, you can do as much today as you feel comfortable. You want to be patient in terms of the process. And remember that you're creating a new habit. And new habits take a little bit of a while to go ahead and develop and to firmly develop that foundation. But be encouraged and perform the exercises at your own pace. Don't be afraid to reach back to a physical therapist that you've worked with in the past to ask specific questions of, or feel free to reach out and let me know if you have some questions. All right. So now the first exercise is called the sit tall exercise. And I start with this one because it really is all about body posture and position. So what you want to do is, if you can, scoot yourself out halfway in the chair. If you can't, then using the back of the chair, or better yet, using the back of the chair with an obus form high back support cushion that you see pictured in the upper right hand side of the slide, is an excellent cushion that will help to promote and improve body posture and alignment. But if you have that control, you want to think about moving yourself forward in your chair. You want your feet hip width apart, okay, and the feet flat on the floor. You can rest your hands lightly on your thigh, or you can rest it lightly on the chair, okay? And you want to look at rotating your pelvis forward. And as you rotate that pelvis forward, you're going to feel an extension up through your spine. So a straightening up of the spine. As you do that, you want to see if you can square your shoulders so that your head and your shoulders are aligned, and that you're tucking your chin back. So tuck your chin back, and you want to take a deep breath in and say E. And hold that exhalation or that E for as long as you can. Okay, and then second time, you want to again recheck that posture. Are your shoulders square? Is your head over your shoulders? Tuck your chin a little bit, okay? And again, deep breath in and E. Excellent. And again, that third time, we're going to go ahead and rotate the pelvis forward. You're going to feel that extension along the spine. You're going to basically square your shoulders back. You're going to go ahead and bring your head over the shoulders and tuck your chin and deep breath in. Very good. Okay, so now this is a wonderful exercise. So this is the sit tall exercise, but you could actually practice this through the day in terms of different positions. So stand tall, sit tall, be tall. Okay, so as you're doing different tasks and activities, think about what your posture and your alignment is in relationship to your overall body position. Okay, so let's go on to the next exercise. The next exercise is the chin rotation exercise. So we're going to use strategies that we learned from the previous exercise. So again, you're going to be scooted out if you can be scooted out in the chair. You're going to rotate your pelvis forward. You're going to elongate your spine. You're going to square your shoulders, get your head over your body, okay, your shoulders. And then what you're going to do is you're going to go ahead in that position. You're going to take a deep breath in. And what I'm going to do is I'm going to go ahead and I'm going to rotate my head to the right side as far as I possibly can. Okay. That's pain-free. And then slowly back to the middle. Okay. And then I'm going to go ahead and rotate my head to the left side. Okay? And back to the middle. Okay? Deep breath in again. Smell the rose. Blow out the candle. And now I'm going to go ahead and allow my chin this time to head towards my chest. Okay? And now what I'm doing is I'm getting a little bit of a stretch on the back side of my head. And then simultaneously, I'm going to do more of a smile position as I rotate slowly towards the right. Again, I want to go as far as that pain-free range allows. And then over towards that left side. And then back to the middle. Okay? And then back up nice and straight and tall, okay? And then from this straight and tall position, I'm going to take a deep breath in, smell the rose, blow out the candle. In this straight and tall position, I'm going to now look over gently and slowly towards the right side, as far as I can. Come back to the middle, tuck my chin, make sure my posture is really nice. Come on over towards the left, nice and slow, pain-free arc of movement. Come back to the middle, okay? Deep breath in and out. And now I'm going to go ahead and bring my chin to the chest. Okay, and this time I'm going to go ahead and take a deep breath in. and I'm going to trace that smile. So I'm going to trace my chin up to the right as far as I can. Pain-free arc of movement. Back to the middle. Rotate my head over to the opposite side. Pain-free arc of movement. Back to the middle. And bring my head up and nice and tall and straight. Okay. Deep breath in. All right, last one in both of these positions. Okay, so I'm going to stay nice and tall, chin tucked, double check my posture. I'm going to slowly rotate on over towards the right, and then slowly come back to that midline position. Again, make sure my chin is tucked. Slowly rotate my chin towards the left. Back to the middle, nice and slow. Okay, take a deep breath in. Slowly bring my chin down to the chest. I'm going to feel a little bit of a stretch on the back of my neck. It shouldn't be painful, but you should feel a little bit of a stretch. I'm going to again take a deep breath in. And remain in good alignment, and then slowly trace my smile with my chin to the right. Pain-free arc of movement. Back to the middle. Again, pain-free arc of movement. Over to the left as far as I can. Pain-free arc of movement. Back to the middle. Slowly come back on up to an erect and tall posture, chin nice and tucked. Last deep breath in. Smell the rose. Blow out the candle. Excellent, guys. So that's the chin rotation exercise. The next exercise that we're going to do is the bend and hang exercise. Okay, so now in this exercise, we're going to be, again, seated nice and tall in the chair. So if you can, you're going to scoot yourself forward, okay? You're going to widen your base a little bit further than the feet apart. So widen your base a little bit, okay? You're going to still rotate that pelvis forward. Feel the elongation along your spine. Your head is going to be, your shoulders are going to be squared over your shoulder, the spine, and then your head is going to be oriented over the shoulders. Okay, tuck your chin a little bit. Your hands are going to be on the thighs, and what you're going to do is you're going to guide the hands down the thighs, reaching down as far as you can go that's comfortable. Okay, so let your body tell you how far you can go. All right, so what we're going to do slowly is we're going to take a deep breath in. And then we're going to slowly drive our hands down the thighs. And as we're driving the hands down, we're going to let the head hang forward. And we're going to count slowly to 10. 4, 5, 6, 7, 8, 9, and 10. When you reach 10, you're going to slowly drive your hands back up the thighs, and as you're doing so, you're moving it back into an erect position. And so you're going to rest a second, okay? Again, you're going to start by rotating that pelvis forward, straightening out your spine, squaring the shoulders, bringing your head back in alignment over those shoulders, okay? And then what you're going to do is you're going to have the hands on the thighs, and you're going to slowly start to drive the hands forward again. And as you do, you're going to bring your chin slowly towards the chest, reaching down as far down to the floor as you comfortably can. And then slow count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you're going to slowly come back out of that position, driving the hands back up the thighs. Again, your pelvis is going to be rotated forward. Your spine is going to be elongated. You're going to square the shoulders over the spine, and then you're going to square that head over the shoulders. Okay, so that's number 2. You're doing great. Okay, so now we're going to go ahead and we're gonna complete the 3rd and final repetition. Okay, so now we're going to go ahead and start driving our hands forward, letting that head hang. Okay, as far down as you can comfortably go. And we're going to count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. And now come back up, nice and slow, driving the hands up the thigh, okay? And up nice and tall, square the shoulders, elongate the spine, orient the head back in alignment, okay? Cleansing breath in, smell that rose. Exhale out, all right? So once you're able to perform these repetitions 3 different times, okay, 1 time a day, then what you can look at doing is increasing it and adding a 2nd rotation or adding a 3rd rotation. So you could think about doing it in the morning and afternoon for 2 times a day, or think about linking it to after breakfast, after lunch, and after dinner for 3 times a day. All right, so that's called the bend and hang exercise. Our next exercise is called reach for the sky, okay? So reach for the sky, if this is the first one you're doing, you're gonna think about scooting forward, okay? Halfway out in the chair again. So again, we're gonna set up like we did with the sit tall exercise. So you want to go ahead and rotate that pelvis forward. You want your thighs your legs to be hip width apart, your feet flat on the floor, okay? Hands lightly resting on your thighs. You're gonna rotate the pelvis forward. You're gonna feel your spine elongate. You want to orient and square your shoulders back, and then square your head over the shoulders. And what you're going to be doing is you're going to be reaching up with one arm at a time towards the sky, okay? The other arm is going to be hanging down towards the floor. And so you can start with either arm. You can select, I'm going to start with my right arm, okay? But you can do either arm. Okay, so bend your elbow, okay? That's going to decrease the demand. And then you want to reach up as tall as you can for the sky. And you're going to hold that for a slow count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. And then slowly come on down and back again. All right. And as you felt, this is actually a really good exercise for increasing the flexibility in both your trunk and your upper extremity at the same time. Okay, so let's go ahead and try that again. We're going to round our pelvis forward. Okay, we're going to go ahead and elongate in the spine. We're going to square our shoulders back. We're going to orient the chin and head back. Okay, we're going to bend that elbow. We're going to then reach up towards the sky, and we're going to let that other arm hang down towards the floor. And 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, bend the elbow. Come on back to that starting position. Okay, you can pause, all right, and rest a little bit. Okay, so let's start that 3rd one, okay, and then rotate that pelvis forward, okay, elongate along that spine, square your shoulders back, get your chin tucked, your head oriented over your shoulders. You want to bend that elbow and then reach up towards that sky. 2, 3, 4, 5, 6, 7, 8, 9, 10. Bend that elbow and slowly come on back, okay? As that exercise is easy, becomes a little bit easier, there's a couple of different strategies that you can do. So the first thing that you can do is when you are reaching up towards the sky, you can also actively reach down towards the floor. And that's going to increase that stretch that you're experiencing, okay? And so it'll increase the flexibility a little bit more. The other thing that you can look at doing is to perform this exercise as well more than one time in the day. So the first would be to add a second set of exercises, doing one in the morning maybe and the one in the afternoon. And then eventually, as that becomes a little bit easier, adding perhaps 3. So doing something after your breakfast, after your lunch, after your dinner might be an easy way of doing it. All right, so now we're going to go ahead and we're going to think about doing it now using the opposite arm reaching up. Okay, so I'm going to start by rotating that pelvis forward. I'm going to elongate along the spine. I'm going to square my shoulders back. I'm going to get my head up and nice and erect and my chin tucked. Okay, I'm going to go ahead and reach my opposite arm now up towards the sky. 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to slowly lower that arm on down. Okay, bring the hands back up to the thigh. Okay, rest a moment, rest for a period of time that you need. You can always hit the pause button on the video, for example. Okay, all right, so let's go ahead and start number 2. Okay, rotate that pelvis forward, straighten, elongate along that spine, square your shoulders back, get that head over your shoulders. I'm going to go ahead and bend the elbow, okay? I'm going to then reach on up towards that ceiling, and I'm going to hold it for 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly bend that elbow and come on back. Excellent, guys. Cleansing breath in. Smell that rose. Blow out the candle. Okay. All right, so when you're ready, you're going to go ahead and rotate that pelvis forward. Okay, third and final round, you're going to elongate along that spine. You're going to square your shoulders back. Get your head oriented over your shoulders and over the spine. And then you want to bend that elbow, reach up towards the ceiling, and it's 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly bend that elbow. Bring your hands back onto the thigh for support. Cleansing breath. Smell that rose. Blow out the candle. Okay, very good, guys. So this is called Reach for the Sky exercise. All right, so the next exercise is the touchdown exercise. And this is where you're going to be doing something similar to the previous exercise, but this time both arms are going to be going up. Okay? All right, so similar situation. If this is the first exercise that you're completing during the bout, you want to, if you can, get yourself scooted out halfway in the chair. You want your feet hip-width apart to your feet flat on the floor. You want to go ahead and rotate that pelvis forward, elongate along the spine, square your shoulders back, get your head oriented over the shoulders and the upper trunk, okay, and tuck your chin a little bit. You want to now bend both arms, okay, and then you're reaching up towards the ceiling here. And with this exercise, you want to practice moving in the opposite direction that your dystonia tends to pull you. So if it tends to pull you towards the right, you want to actively move towards the left. If it tends to pull you towards the left, then you want to go ahead and actively move your chin or your head towards that opposite side. If the dystonia wants to pull you back, then you're going to want to go ahead and tuck your chin and pull it forward. Okay? So you want to move in the opposite direction as the cervical dystonia. And you want to slowly count to 10 as you're doing that. Okay, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. And I'm going to slowly bring my arms down. Cleansing breath in. Okay, so this exercise has a dual purpose. So what you're doing is you're working on body posture and alignment. You're working on flexibility in the trunk and in your extremities. And then you're also addressing the issue of the imbalance. So I kind of like to think about the dystonic muscles, the muscles that are pulling, as the Goliath in the room. And so the muscles on the opposite side are the David. Okay, so David and Goliath. The biblical reference is David had the slingshot and he was able to combat Goliath. And so you want to think about developing that strength in the David muscles, the weaker muscles on the opposite side with the dystonic set of muscles. And this is one of those exercises that will help you do that. All right, so let's look at doing number 2. Okay, so I'm going to rotate my pelvis forward. I'm going to go ahead and elongate along the spine. I'm going to square my shoulders back. I'm going to bring my head back and in alignment with my shoulders and trunk. I'm going to tuck my chin a little bit. I'm going to bend my elbows up, and I'm going to reach up towards the ceiling or in a touchdown position. And then from this position, I'm going to go ahead and actively move as far as I can through a pain-free arc of movement in the opposite direction of my dystonic pull. Okay? And then I'm going to hold it for 10 counts. 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to slowly bring my head back to the midline. Bring my arms gently down, supported by the thighs, and relax. I'm going to do a cleansing breath in. So deep breath in. Smell that rose. Blow out the candle. Okay, very good. All right, so you can hit the pause button, okay, if you need a little bit longer rest, or we'll go ahead and move forward with that third time. Okay, so I'm going to start by bringing my pelvis forward. Okay, I'm going to elongate along the trunk. I'm going to square my shoulders. I'm going to bring my head back into nice alignment. Okay, I'm going to bend my elbows. I'm going to go up slowly into a touchdown position. I'm going to move in the opposite direction of my dystonic pull, and then I'm going to slowly count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to slowly come back to the middle. I'm going to come down nice and slow with my arms supported onto the thighs, and then cleansing breath in. Smell the rose. Blow out the candle. All right, very good, guys. So again, you can increase the difficulty with this one. So start out maybe 1 time a day, and then go to 2 times a day at a second session as you improve, or as you continue to improve 3 times a day. So the more you're able to practice these flexibility exercises, these postural exercises, practice that is actually a huge piece in terms of neuroplasticity and making actual changes in terms of how we're imprinting on our brains. And so that's that brain training piece as well. All right, so that's called the touch count exercise. Okay, so the next exercise is exercise for that addresses the rotational dysphonia. And so this is taking out the arm element, and it's kind of you have to play and see, do I actually move better when my arms are engaged in the exercise, or do I actually move better in my cervical spine if I'm just trying to move my head? So that's going to take a little bit of practice, and you've got to see which one is going to piece out for you. All right. So if this is the first exercise that you're going to be doing, you want to scoot yourself forward if you can towards the middle of the chair. You want to have your hips, you want to have your legs hip width apart, your feet flat on the floor, okay? Your hands lightly resting basically on the back of your head now. So you're gonna not pull forward, but it's gonna be a very gentle, light placement on the back of the head, okay? I'm going to think about getting my pelvis up nice and straight and sound, okay? So that I elongate along that trunk again. I square my shoulders back. I get my head back, and I can press a little bit gently into my fingers, for example. And then from this position, I want to move in the opposite direction of my rotational pole. So if my dystonia is pulling me to the right, I want to go ahead and move in that opposite direction. And then I want to do a slow count then to 10. So I want to try to hold that position. As I do the rotation, I want to make sure that I'm not actually moving my trunk or my arms as I complete it, that the movement is indeed occurring with just my head, okay? And it's that pain-free arc of movement. I'm going to hold it for a slow count to 10, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to slowly bring it back to the middle, and then I can bring my arms on down and let it rest and relax. And I can rest for whatever period of time I need to rest. So you can hit the pause button or the stop button on the video to allow you a little bit of a rest cycle that you personally need. Okay, so now I'm going to go ahead and do the second round. I'm going to bring my pelvis forward, bring my fingertips lightly to the back of the head. Okay, I want to make sure that my spine is erect, my shoulders are squared over my trunk, and that my head is tucked back. And then I'm going to move in the opposite direction of that rotational pull of the dystonia. Okay, just allowing the movement to occur in the head. 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back slowly to the middle. Bring your arms down, okay? And then let's try a cleansing breath. So deep breath in, smell the rose. And you can relax. Hit the pause button on the machine. Let yourself rest a little bit, okay? Okay, let's proceed on forward again. So we're going to go ahead and rotate that pelvis forward. Let's bring your hands, fingertips lightly to the back of the head. Okay, you're going to elongate along that spine, square the shoulders, elevate or bring your head back, tuck your chin, and then slowly rotate towards that dystonic position. Okay, and then count to 10, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I'm going to slowly rotate back to the middle. Okay. Bring my arms down, Resting on my thigh, I can go back into a posterior tilt a little bit, and then cleansing breath. Deep breath in and okay. And that's exercise for rotational dystonia. This is another exercise program that as this becomes a little bit easier and easier to perform, then what you can look at doing is adding an additional exercise program. So if you're doing it in the morning, adding it to the afternoon, or as that gets a little bit easier, making it a 3 times a day exercise. So after lunch, after breakfast, after lunch, and then after dinner. All right, so the exercise for rotational dystonia. Okay, so now what we're going to be considering next is we're going to be looking at strengthening the agonist. And this is basically what we're going to be kind of going over and talking about more in a generalized sense. So because everybody has unique muscle groups that are the Goliath in them, the dystonic muscles in them. And so what you want to think about is what I was talking about a little bit in the last exercise. You want to learn how to develop and strengthen that non-dystonic muscle to help to correct the dystonia. And so it really requires repeated contraction of these muscles. So learning how to do the exercises in a optimized body position is going to be very helpful for you. And then working with, it might also be helpful to reach back to your physical therapist that you worked with in the past to look at exercises or muscles that have been problematic for you personally, and then developing exercises that will countermand that Goliath or the dystonic muscle. So it's definitely something that you want to reach for and be completing on a regular basis. And so this is a concept that you can look at and work with your physical therapist. And then you also want to be aware that you want to think about sprinkling it in to your everyday activities as well, so that you're more aware of body posture and alignment to enhance how you're performing your day-to-day tasks as well. And so you want to perform these exercises several times a day for about 10 to 15 minutes. And so this element is really done best, again, reaching back to your physical therapist and looking at and customizing the program specific to your issues and concerns. All right. The next thing that we can talk about is the use of sensory tricks. So this is a technique that is done by a variety of individuals with dystonia. So individuals with cervical dystonia, for example, find sometimes that placing a finger on the side of the nose, a finger on the mastoid process, a finger on the chin, okay, or a couple of fingers on the chin or a finger on the chin helps to go ahead and dampen down that muscle pulling that's occurring. And so the question that some of my patients have is, how do I do this during the COVID-19 pandemic when we're instructed not to touch our faces? And so what you can look at doing is maybe wearing a face mask and touching through a face mask might be a strategy that you can do. You can use really regularly through the day, wash your hands so that your hands are nice and clean is something that would be important, using hand sanitizer if you don't have soap and water available. And then when you're washing your hands, you want to remember to do it for a long enough duration of time. So sing happy birthday to yourself as you are washing your hands, and that will ensure that you're doing it for the appropriate period of time. All right, so next is the concept of mirror therapy. And so the important thing to recognize with cervical dystonia is it does certainly impact the motor side of the equation, but it actually also impacts the sensory side of the equation. And so when a person has assumes poor posture and alignment for an extended period of time, this begins to feel normal. And so when they go into a more erect and optimized posture, that may actually feel abnormal to an individual. And so if that's happening to you, then a piece of what you want to look at doing is retraining your cervical proprioceptors in terms of knowing where your body is or your head is in relationship to your trunk. And so one of the ways that you can do that is by using a mirror. So you want to do these exercises with a mirror in front of you. And so you want to again, start by doing it with good posture and good alignment. So if you're way back in the chair, if you can, you want to scoot yourself halfway out in the chair. You want the legs hip width apart, feet flat on the floor. You want to go ahead and be sitting up nice and straight and tall, okay? And so you want to look at completing that movement several times with your eyes open, and you're watching yourself complete that movement. So you want the pelvis to come forward, that you're elongating through that trunk, that you're seeing the shoulders square over your base support, and that you're able to reorient the head over your base as well, and that you're able to tuck that chin. All right, so then you're seeing yourself do it. So now what you want to try is try closing your eyes. And you want to go ahead and you want to try doing that same maneuver with your eyes closed. So rotating the pelvis forward, elongating elongating your spine, getting your shoulders square, and then getting your head nice and erect. And then what you want to do is you want to open up your eyes and see are you able to get that same impact or movement capability with your eyes closed as you are with your eyes open, okay? And so this will help you in determining whether or not you need to do a little bit more of the cervical rotating, the proprioceptive retraining. Okay, so that's a sit tall piece that you can do. Okay, you can also do it in relationship to the rotational element. Okay, and so I'm gonna rotate my pelvis up. I'm gonna elongate along the spine. I'm gonna square my shoulders back. I'm gonna get my head nice and erect. I'm gonna tuck my chin. I'm gonna have my hands lightly positioned on my legs. And then I want to get a sense of what's 100% of my movement capability in the direction opposite of my dystonia. So how far can I move through that pain-free arc of movement? And how does that feel? Okay, in terms of my head nice and erect and only my head rotating, not my shoulders or my trunk. Okay, and then I'm going to go ahead and I'm going to do that with my eyes closed. So I'm going to go ahead and come up nice and tall with my eyes open still, okay? I'm going to elongate along the spine. I'm going to square my shoulders. I'm going to bring my head back. I'm going to tuck my chin. Now I'm going to close my eyes. And I want to see how far I can get at 100% of my available range. And you might need to have a mirror, a couple of mirrors or positioned such that you can see yourself at that end position as well. So I think I'm at my end position. I want to open my eyes and I want to confirm, am I truly at that same end position I was with my eyes open, okay? I can repeat this same exercise saying, okay, I want to go to now, if this is 100% of my available range, I want to just get to 50%. Or I want to get to 75%, or I want to get to 25%. So you can modify the arc of the movement and repeat that. And so this is really looking at helping to change the sensory side of the equation to make you more aware of the movement that you're truly completing and doing. Okay, so actually a very important concept in consideration out in the literature. Okay, try Google searching mirror therapy, and it really has some interesting analogs. Okay, so all right. So now another exercise program that we're not going to really link into today, but I want you to be aware of. So this is a link to a seated yoga exercise session. So it's something for you to view and look at, and to see if you might want to consider trying in the future. So it might be something that piques your interest. And so again, with this video that we have embedded, you just need to go ahead and click into the link. It's an exercise, it's a yoga instructor that is training beginning individuals in the concepts of completing yoga exercises. And so again, you can do the same paradigm. So you could choose to, if you're used to exercise, sample the exercise and follow along with the instructor. Or you could choose to do one or two of the exercises and then watch the remaining portion, or you can choose to watch the entire piece. So again, this might be an exercise program that you share with the you reach back to your therapist that you like to work with, and that you both explore to see if this might be a complement or a piece that would be appropriate for you. Okay, so yoga for beginners, and it's a seated yoga exercise program. The next slide looks at Tai Chi, so seated Tai Chi for beginners. So a similar type of a situation. This is a video that you can again do the entire piece. If you're used to exercise, you can do just a portion of it, or you can just view and just fulfill your curiosity, take a look at it, see if it's something that you might be interested in performing, and then reaching back to your physical therapist to see if perhaps some or all of these exercises might be of interest or appropriate for you to perform. Okay. All right, so now let's look at the mental health side of the equation. So again, remember that the realities of staying at home, working from home, maybe experiencing temporary unemployment. You might be needing to homeschool yourself if you're taking classes, or homeschooling your children or your grandchildren. So all of those have been just hugely challenging for individuals. In addition to a lack of physical contact with other family members or friends, really takes its toll. So you want to think about and recognize that perfectly normal type of a situation to maybe feel overwhelmed, perhaps feel a little bit more anxious, maybe experiencing a little bit of depression. So there are strategies that you can try to do on your own, but I would also argue that you want to look at and be open to reaching to a person that specializes in this, a psychologist or a psychiatrist that can help step you through this very challenging period of time. And again, psychologists, psychiatrists have clinic-based appointments that you can avail yourself of, or many are completing Zoom or doing it telehealth type of a situation as well. So just be aware of that. So if you need a referral, reach back to your physician, or again, Martha Murphy is a wonderful resource for you guys. So you could reach to her in terms of some referral ideas or suggestions. Okay, so but in general, some things that you want to consider in terms of your mental health is keep being informed, but not to the point where you're feeling overwhelmed, okay? Having and establishing a daily routine is incredibly important. Keeping and maintaining personal hygiene is going to be important. And then remember to reach out. And if you don't have family immediately in your home environment, try reaching out by Zoom or by FaceTime, or by other mechanisms that you prefer. or you can do Zoom family sessions. You could participate in Zoom book clubs, Zoom faith-based groups, Zoom exercise groups. So just remember that there are possibilities out there. Think about allocating time for work and a time for rest during the day. So you want to parse up your day and kind of pace yourself. And then make sure that you do things that you truly enjoy on a regular basis as well. And so some of us are feeling a little bit, developing a little bit of cabin fever. And so I'm going to be giving in the next slide some ideas where you can take a virtual tour. So for example, my family and I take virtual tours every Sunday. And so we've gone to virtually San Diego Zoo, or we've gone to Yellowstone or Yosemite, or Washington, D.C., or San Francisco, or there's ones to New York City. There's a myriad that you could look at. So just Google virtual tours, and you can pull up several ideas that perhaps might be of interest to you. You also want to think about helping each other out. Being kind to one another, and don't be afraid to reach out and ask for help, because we all need that during this period of time. So here are several links that I came up with in regards to the virtual tours. My kids love animals. They love the San Diego Zoo, which is right in your backyard, and it's an amazing zoo. So there's a pretty neat tour there. Yosemite Park, the National Park Service offers a link. There's a 3D view of Yellowstone Park, a really neat park to go visit if you've never had the opportunity. And there's a cool San Francisco kind of a Zen experience where there's not a lot of audio, and you're just watching the individual walk through these different areas. And then if you've ever been to Washington, D.C., or have had the amazing experience of seeing Washington, D.C. during the peak cherry blossom season. And if you haven't, this is a great tour that you could perhaps tap into. And then the other one that I did was, again, knowing that you guys are all from the San Diego area, there's a San Diego 360 degree visit. So it's being able to get out and see your beloved city. And be able to explore it as well. So virtual tours to get us virtually out of the house. Okay, so that the next slide that I want to go over is a concept of mindfulness, which is hugely important and something that you can think about tapping into as well. So that we know that there are 3 distinct benefits that are in the literature. So mindfulness has a health benefit, it has cognitive and emotional regulation benefits, and it also helps us to reestablish our sense of joy. And so in the literature, you can see research that the practice of regular mindfulness can help us to manage anxiety and help tamp down or reduce stress. And then it also has a wonderful capability in enhancing cognition and emotional regulation. And I know it's used, I have teens in my household, and my daughter experiences a lot of anxiety and depression. And so she actually uses mindfulness as a way of coping with it. And so it helps to promote stronger focus, it helps enhance memory, and it helps us with better problem solving qualities as well. And so mindfulness also helps us to cultivate mental agility and flexibility. So it allows us to reflect back on pleasant experiences that we experience. Maybe that super blue sky, the spring blossoms, the sound of laughter, the sound of maybe a waterfall. So really experiencing those in really kind of taking us back to the basics. So a couple of things that I thought about that might be a help to you guys is there's a concept for mindfulness that you can practice. So practice observing, practice describing, and then practice participating. And you can try 1, 2, or 3 of these different avenues and see how you do with these. So with practice observing, you wanna look at and just look at things that you're seeing and really take time to go ahead and fully observe it. Think about what you're hearing and fully think about the entirety of what you're hearing. Or the sense of smell. So thinking about smells that are around you. Think about urges to do something. So where is your mind taking you to? Maybe body sensations, doing a body scan. Where do you feel, where are you contacting the surface that you're either seated on or that you're standing? See if you can do a body scan and figure out those components. You could also practice thinking about thoughts that are coming in and then thoughts that are going out. So kind of like a rolling in, like a wave coming in onto the sand and then maybe rolling out. Or you could focus in on your breathing. So your breath, the movement of your stomach, the sensation of the air moving in and then moving out. So that's that cyclical pattern that's occurring, okay? Or you can practice describing. So describing what you see on the outside of your body. You can do it verbally, or you could journal it if you'd like to. You can think about and practice describing your thoughts, your feelings, your body sensations inside yourself. Or again, you could look at describing your breathing and what you're experiencing, and then participating, getting yourself on in there and participating. So you can practice moving to music, listening to your favorite music, something that maybe helps to bring you joy. You can sing along to a favorite song. You can sing in the shower. You can try taking a walk and notice at least 3 things that you haven't taken the time to notice and appreciate lately. So it's really, really drilling down to kind of foundational concerns and taking us to the basics. So mindfulness is a very, very potent strategy that we can all look at and employ. The other concept that we can look at doing is, especially as our areas of the world start to open up, our cities, our counties, look at taking a walk outdoors. So if you can't get outdoors, walk around your house, walk around your yard. Okay, if you can get outdoors, walk around your neighborhood, walk around your park. Maybe get out and garden a little bit, okay? And then as you're out and about, you want to think about the social distancing, keeping at least 6 feet away from individuals when outside. And then use the guidance from what you're hearing from the health department in terms of the appropriate protective equipment. So for example, in California, it would be face masks when heading outside. And then think about reducing your risk during this COVID period of time. You want to wash your hands regularly. Think about singing happy birthday. So you're doing it thoroughly and for an appropriate duration of time. Remember to wear a mask when you're out. Maintain social distance. You want to follow the Department of Health recommendations as we begin to slowly reopen, okay? And if you have experienced any symptoms, then reaching out to, calling your doctor would be a good idea, and letting them know any signs and symptoms that you're experiencing, such as a fever, if you're experiencing a cough, respiratory compromise, then you want to let the doctor know that. And any new or unusual gastrointestinal issues, anything that would be unusual, calling the doctor, they can step you through to figure out what's going on and make appropriate recommendations for you. So most importantly, you wanna be safe and be well, okay? So, all right, so what did we accomplish during this cycle of time? Well, we looked at several measures that you can do to help to reduce the spread of COVID-19 and reduce the impact of COVID-19 on your regular exercise schedules and not allowing it to disrupt your workout routines. We also looked at how exercise and why exercise is important during this period of time. It's important all the time, but especially during this period of time in terms of reducing stress, preventing weight gain, boosting your immune system, and improving your sleep pattern. And then just know that you can safely engage in strategies that promote wellness. So the talk today wasn't just about exercise. So you want to, when you're thinking about exercise, if you have any questions at all, please do reach back to the physical therapist that you have used in the past, either by seeing them in the clinic or if that doesn't feel comfortable to you, then setting up a telehealth possibility to go over the exercise strategies and personalize the exercise program to yourself. Remember that that exercise is an important element, but it's not the entire element. You also need to think about your mental health as well. And so if you think you're experiencing anxiety and depression, don't hesitate to reach out to a psychiatrist or a psychologist that you've worked with in the past. If you need guidance in terms of a referral, reach back to Martha. She's a huge help in terms of that type of a guidance or recommendation, or reach back to your doctor. They can also help to provide some recommendations. If you are experiencing difficulty in locating an individual, remember Martha Murphy. If you're experiencing difficulty in the exercise piece, then you're welcome to go ahead and reach back to me as well. Okay. Remember that the mindfulness exercises are definitely worth a trial period of time, and that you can try the different suggestions that I came up with. And so remember that eating healthy, getting optimal sleep are also very important strategies to help to boost your immune system. So I'd like to take this moment to thank you very much for your participation in this video. And I appreciate the time that you took in terms of going over these concepts. Thank you so much.